Hi everyone. For Intersystems, my name is Tom Keppeler and I'm Director of Corporate Communications. I'm joined here by Dr. Bruce Walker. Bruce, as you might recall, is the Director of the Ragon Institute and presented last year at our virtual summit around the race for COVID-19 vaccine. Bruce has joined us today to share some more information about COVID-19, the virus itself, and the safety and efficacy of the vaccines. Without further ado, I'd like to hand things over to you, Bruce, and take it away.
Thanks very much, Tom, and it's great to be invited back. What I'd like to do is take you back to the beginning of the pandemic and really help you to understand why we're where we are now and what the future holds. So it was December 2019 when a new pneumonia appeared in people in a section of China. We had no idea what that was, and yet within really the span of 4 or 5 weeks, the virus that was causing this, which was a novel virus never before seen by humans, had already been identified and sequenced, which is really an incredible feat, because if you compare that to something like HIV, 40 years ago when HIV hit the scene, it took 3 or 4 years to figure out what was actually the cause of that pneumonia. And here we had this completed really within an incredibly short period of time. So what is a virus? A virus is basically a package of genetic material. So this is a genetic material here, the RNA. It has an outer coating, in this case with a spike protein, and the viruses are unique in that they really can't replicate on their own. They need a host cell in order to reproduce themselves because they just don't have enough genetic information. What they do is they commandeer a host cell and force it to make new viral proteins. So that's really how we get into the situation of viruses sort of with very few genes actually being able to hijack a cell to force it to do what the virus wants it to do. So that's how we end up with this pandemic. It's this virus that's basically commandeered human cells to force them to make more viruses.
So Bruce, why does SARS-CoV-2 cause pneumonia in the first place?
The reason it causes pneumonia is because the virus needs a surface protein on a cell in order to get into the cell. And it turns out that this receptor that the virus uses is on cells that are in the nose and lung. And so that's why you see the problems that you see with pneumonia in this infection.
Sure.
So the question is, how did we end up with this pandemic, and why is SARS-CoV-2, the virus that causes COVID-19, why does that transmit so readily? And it's because it's by aerosols, by droplets and aerosols that are produced by the lung, and those then are inhaled, and that's what leads to ready transmission.
So a question we keep getting from our community is, how long does it stay airborne, and how long does it live on surfaces?
Well, those are really good questions, Tom. And in fact, it's the aerosols, these very tiny these very tiny particles that can actually remain in the air for minutes to hours. The droplets themselves tend to settle out much more rapidly. And in terms of how long it stays on surfaces, it does land on surfaces. You can recover some viral RNA even 2 or 3 days later. But the reality is that there are not many transmissions that actually seem to happen from touching surfaces. As long as you don't touch something where somebody's just sneezed on it and then touch your mouth or nose. And that's actually one of the reasons that masks probably help, is because it keeps people from touching their mouth and nose.
Right. And it's important to point out that you and I are both vaccinated.
We are.
And a safe distance away from one another. The crew that surrounds us in the studio here,
yep,
everybody's got masks on as well. So
yeah,
we're taking all the precautions we can.
Yeah. Great. Okay, so another issue is the fact that we see this pandemic rolling out in waves, in fact, in surges, where if you look in the green here, what you're seeing is what's happened in the US, where there's a surge here and another surge here, whereas the timing of a surge in India is completely different and goes to a different level.
So Bruce, what's causing these surges?
A very good question, and something that we don't entirely know the answer to. There are a number of different factors. Was there a lockdown that helped to prevent further spread? Was there some seasonality to it? Were there super spreader events that might have contributed? Are people getting vaccinated and actually being protected from that? Or are people changing their behaviors? So there's still a mystery about why these things come and go. We don't know completely the answer to that.
Okay.
How does the body fight back when somebody gets infected? Well, the way it does is by generating antibodies. Antibodies are produced by a cell in the body called a white cell, a B cell. And these antibodies actually work by basically binding to the spike protein on the virus, and that prevents it from entering a cell. So that's really what we're going for to try and prevent infections, is to glom up that spike so that it can't bind to the receptor and get into the cell in the first place. So ideally what happens when you get infected is that you develop antibodies, and these antibodies would actually result in immunity to protect you in the future once you've cleared the infection.
So how long do antibodies last typically once you're infected?
So it's a very good question, and one that we don't have a full answer to because we haven't had people infected long enough to know what the longest is that you can keep those antibodies. But from somebody that's been infected, the antibodies seem to last at least 8 months. And in people that have been immunized, we're seeing some decline, not dramatic declines, but some decline even after 6 months. So there is a diminution. We expect that with antibody responses.
So that gives rise then to the need for boosters, is that right?
That is correct. So the level that most people have of antibodies is sufficient that probably there's not an urgent need for a booster for many people. But if you're older, if you're immunocompromised, if you're heavily exposed, the level of antibodies appears to be what's important to prevent you from getting infected. And so the booster shots would be useful to try and boost those levels.
Great.
Let's go on and talk about infection-acquired immunity. Why isn't it better than why doesn't it last longer? Why doesn't it get to higher levels? And one of the reasons that we believe that antibodies are impaired is because the virus itself infects the organs in the body that help to make those antibody responses, things called lymph nodes, which are in your neck and groin, under your arms. And that leads to weakened antibody responses because the virus is actually doing damage to the immune system.
So if someone has had an infection with COVID-19, should they get vaccinated?
That's also a very good question. And the answer to that is yes, absolutely. And the reason is that the levels of antibody, even by natural infection, are not as high as they need to be to really protect against not just the original virus, but also the variants. And what's interesting is if you have been infected and then you get vaccinated, you really end up with super high levels of antibodies.
Great, thank you.
So let's talk about a vaccine. What is a vaccine and how do you create one? Well, I told you before that the virus itself, when it infects somebody, damages the immune system. So the goal here is to teach the immune system how to see the virus without it ever seeing live virus. And the way we do that is to just give the relevant part of the virus to educate the immune system, which is the spike protein, and try and use that then to as a way to be able to generate the antibodies without ever seeing virus.
So there's a lot of concern around this topic here, and that is whether the vaccine as it's administered, whether that can cause infection.
Yeah, and the answer to that is absolutely not. None of the vaccines that have been developed actually involve live virus. They're all this kind of concept where you're just expressing part of the virus, or it's a heavily inactivated, damaged virus that can't replicate, that can't reproduce itself.
Thanks, Bruce, I appreciate it.
Yep. So now let's talk not about infection-acquired immunity, but vaccine-acquired immunity. And here the idea is really simple. You take not the virus, but you take a spike protein, you inject that into the body, generate antibodies, and then without having ever seen live virus, the person hopefully ends up with immunity. That's the goal of a vaccine. And in fact, there are a number of different vaccines that have been made and that are now in production, and those are shown here, and include genetic vaccines, the mRNA vaccines, inactivated viruses that have genetic material spliced into them to make the spike protein, just the spike protein itself, or even, as I mentioned before, these inactivated viruses.
So Bruce, for many of us in this, in sort of the non-scientific community, it seems like the vaccines got made awful fast.
Yeah.
So were they made too quick, and were corners cut along the way here to get vaccines rushed to market?
Yeah, I can understand how people have that concern, but in fact, it's the investment over decades in vaccines and understanding the immune system and developing platforms to make these vaccines that actually made this possible. And in fact, there are a number of different things I can point to here on this slide. SARS-CoV-2 was rapidly identified and the information was shared, so people across the world immediately could start working on it. There were existing vaccine technologies, including mRNA vaccines, that had been in people and had been tested. They hadn't been licensed yet, but those platforms were already there, and it was just kind of plug and play. There was unprecedented collaboration that occurred across the world. There was catalytic funding that allowed the people to really get started fast out of the blocks. There were huge clinical trials, and there was ongoing high levels of infection, and that meant that you could actually test the vaccine quickly. The more people that you could enter into these trials, and the more that the virus was spreading, the better chance you had to see if a vaccine was working or not working. And then finally, I mean, you could call this a risk, this final point here about the manufacture of doses before the trials were completed, but this was a risk that the companies were taking, which is basically they were making a bet that hopefully this vaccine is going to be protective. We don't want to then wait a year to make the vaccine if we show that it's protective. We want to get started right now to make enough for the world. If it's not protective, we'll have to throw this all away. But that was sort of where the catalytic funding also helped them to be able to do that right away.
That's great.
All right, so how do these vaccines work? Well, again, let's talk about the mRNA vaccines, which are one of the major weapons that we've got now to fight this virus. mRNA vaccines are basically a little bit of RNA, the genetic code for spike that's inside of a little fat molecule. That gains entry into a cell. Viral proteins are made, the spike protein's made. It's expressed on the cell surface, and that generates then these antibody responses that allows the body to fight back against this virus.
So then, can the mRNA administration of the vaccine, can that then become part of my own DNA?
It cannot. So the mRNA can never get to the nucleus, which is where your DNA is, and it has no means to intercalate into the DNA. So that's something we can be very confident about. This does not alter a person's DNA. In fact, the RNA is really present for only a day or two before it's degraded.
Great, thanks.
So another question that's worth addressing is, why do some vaccines require 2 doses? And the reason's really shown here. It may be that with the first dose, you get a level of antibodies produced, but these wane, and then you need a second booster shot, a second dose of vaccine to get up to a level where you have persistent high-level antibody responses, and to keep you above this level of antibodies that's needed for protection.
So how long does that protection last from a 2-shot or even a single-shot vaccine?
So you're really not protected until 2 weeks after the mRNA vaccines, and probably a little bit longer after the Johnson & Johnson vaccine. But that immunity lasts, in the case of Johnson & Johnson, probably at least 8 months, and it's starting to wane at 6 months with the mRNA vaccines. And that's the reason that there's been a lot of interest in these booster vaccines. Again, if you're older, if you're immunocompromised, those are individuals that are at higher risk for having a loss of antibody responses more rapidly. So just to give you a graphic to show you just what an impact these vaccines are having, take a look at this slide, which are the number of hospitalizations in green in people that are fully vaccinated, and in blue over time in people that aren't vaccinated. So there is no question that these vaccines are having a huge difference. In fact, maybe one of the most dramatic differences of a medical intervention that we've seen certainly in our lifetimes. In fact, the CDC has looked at this, and the chance of infection is about 5-fold higher if you're not vaccinated. The chance of hospitalization is more than 10 times higher if you're not vaccinated, and the chance of death is more than 10 times higher if you're not vaccinated. So what this says is that the way that you can protect yourself is to get vaccinated.
That's wonderful. Thanks, Bruce.
Another issue I'd like to address is the issue of side effects. There has never been a vaccine for which there's not some level of side effects. Often it's just muscle ache, ache at the site of injection, sometimes a little bit of fever, which is really a sign that your immune system's reacting to the vaccine, which is actually, I think, a good sign. But there are some side effects that have been noted with these vaccines. One is blood clots, which is this thrombosis and thrombocytopenia syndrome. It occurs at about a rate of 3 per million individuals who get immunized, so it's very rare. Can also be prevented or it can also be treated when recognized, and now that we know it exists, we can watch for it. But it's 15 times more likely to happen if you get infected. And so the side effect is there, yes, but in fact you have a greater risk of that side effect if you get infected. Similarly, heart inflammation or myocarditis is something that's been seen with the mRNA vaccines. Again, it's rare, about 3.5 cases per million individuals who get immunized, but it's 6 times more likely to have this happen after, if you get infected as compared to being vaccinated. So these are the vaccines that are currently in the red boxes, are the vaccines that are really available to us in the US. And I know you have a global workforce, so I've listed the others that are up there as well, that have been given to people. All of these vaccines work. It's just an incredible story of success that this happened and happened so quickly.
So Bruce, we've got all these vaccines available worldwide. Which one's the best?
Yeah, so I'll say again that all of them work and all of them protect against the regular strain and protect to a slightly lesser degree for some of them against the variants. But in terms of the best vaccines, the one that is the most protective is probably the Moderna mRNA vaccine, but the Pfizer is at a comparable level. It just drops off a little bit more rapidly. The Johnson & Johnson vaccine takes a little longer to get to levels. There are new data that boosted Johnson & Johnson vaccine gives you really high levels of protective antibodies. So I think it's hard to say that any of these is really the clear winner.
I think a big question on people's minds, especially as they look to get boosters, is can they mix and match vaccines?
Yeah, so the FDA has been dealing with this question actually this week, and they'll probably make a determination next week. I think that probably they will allow for mixing and matching, and that we'll see as the FDA and CDC take this up. But there's no reason a priori to think that that would not be good, and there's some clinical trials that have been done where this has been tested and actually shown to be able to boost strong responses when you mix and match.
So which of these vaccines requires a booster and has an approved booster, and who's eligible for those?
So right now, the booster shots are available for the Pfizer vaccine. We will know, the advisory panel has already suggested that boosters be made available for Moderna and Johnson & Johnson, and we'll know probably in the next week or so how the FDA and CDC come down on that issue, because they have to give final approval. But I think for all of these booster shots will be available. They'll probably be limited to based on age and status of immune compromise. But they will basically, I think they'll be available to most people.
And here in the Northern Hemisphere, obviously, we're headed pretty rapidly into flu season. So the question on a lot of people's minds is, should they wait to get a flu vaccine?
Yeah, and here again, Tom, the answer to that question is do not wait, get the vaccine. Influenza is a real threat, and with less mask wearing, I expect that we'll see a lot more influenza this year. There's no reason to wait at all. The shots can be given at the same time. That happens with lots of different immunizations that we give them simultaneously, and that's the case for the flu shot with the COVID vaccines.
Thank you.
So let's now talk about the variants. We started out with a virus that began in Wuhan, China, first isolated there. Then there was a virus that was isolated in England, now called Alpha, Beta in South Africa, Delta in India. And it's been this global surveillance that has allowed us to see that all these variants have happened. And the fact of the matter is that viruses like SARS, when they reproduce themselves, they make mistakes. And that's how this variation starts to happen.
So do the vaccines protect against the variants?
Thankfully, they do, against the variants that we have seen thus far. They're really quite protective. Again, it depends on the antibody levels, but we're seeing really good cross protection against all of these different variants.
And is Delta as bad as it gets?
Well, that's also a very good question. And one of the things that I worry about is that we don't know that the virus has necessarily created the worst form of itself. The more people that get infected, the more chance it has to mutate as it's replicating in those people and find new mutations that make it either more transmissible or more infectious. So we have to be concerned about that. And it's why we have to continue with this vigilant approach of trying to get everybody immunized and trying to protect people from getting infected.
So I've been vaccinated. All of us at Intersystems have been. Can I still get the infection?
So the answer to that is yes, you can. But the likelihood that you will get a symptomatic infection or need to be hospitalized, and most importantly, the chance of death is dramatically diminished in terms of being vaccinated and then getting infected on top of vaccination. I also just want to make the point that most vaccines, in fact, I would say essentially all vaccines that we have are not 100% effective against a minute amount of infection happening. It's just that they stop that in its tracks. And that's what the goal is with these COVID vaccines, is to really diminish the amount of damage that can be done, even if they don't fully protect. And that's actually what we're seeing, is that it is protecting against symptomatic infection, hospitalization, and death, even though people still can become infected. So, Tom, one of the other things that I wanted to mention is this whole concept of herd immunity. If you have somebody who's infected and lots of people in the surrounding area have immunity, either from having been previously infected or from being vaccinated, the likelihood that that person is going to encounter somebody who's not infected to be able to transmit their virus is much smaller. And the question is, can we get to that level with SARS-CoV-2?
Right. So that is indeed the question. Is herd immunity possible?
So the answer to that question is that something akin to herd immunity is possible. That we will get to a point where there are very few people that are not immunized, either from infection or from vaccination. But I think because reinfections can occur, we will continue to see this virus in the population. And so that is something I think that we're going to have to learn to live with. And one of the other reasons that I would say that is because, we don't know exactly where the virus came from. Probably was originally in a bat. may have gone through a pangolin. The question is whether there was a laboratory accident also involved in that. The fact of the matter is it got into humans, and the reality is that humans have passed it to other animals. And so we basically have an animal reservoir in addition to the human reservoir, so that I don't think we're ever going to get completely rid of this, but I think we're going to have people have enough immunity that this will become a minor, more kind of like other coronaviruses, where there's a minor upper respiratory symptoms, like a minor cold, is what the hope is.
Great.
So I want to end by just suggesting that people may want to read this book, which was written by one of the founding members of the Ragon Institute, our institute, called Viruses, Pandemics, and Immunity. And it really does, I think, a terrific job of helping you to understand how viruses cause disease, how they create pandemics, and how the incredible force of our immune systems and vaccines can actually control these pandemics. So I would highly recommend that.
That's good. Suggested reading for all of us within the Intersystems community. Bruce, this has been a great presentation. We've got 3 questions left from our community, and the first is this: when should I wear a mask, and what type of mask is the best?
So the most important thing is to get vaccinated, but you can further protect yourself if you wear a mask. When should you wear a mask? I think outdoors, there's no real reason to wear a mask. If you're indoors, it really depends on the situation. And I think that it depends really on what the risk is of transmission in that inside setting. Is everybody vaccinated? Is there good air exchange? And I think for anybody that's concerned about those things, wearing a mask just enhances the ability to protect yourself from becoming infected.
A lot of us travel, and our business travel, of course, is limited. But on airplanes in particular, and in airplane terminals, what's the best way of going about it?
I would definitely, under those circumstances, I would wear a mask. And in fact, it's required on airplanes. But there again, you're in an indoor area. If it's crowded, I would definitely wear a mask. If you're off by yourself in an airport, probably not as dangerous, but again, it all depends on the level of risk you're willing to assume.
Let's say you're traveling, and so does a cloth mask provide me with enough protection, or a filtration mask like an N95 or a KN95? Is that what you'd recommend?
Yeah, so that's a really good question as well. The cloth masks actually are not that effective. And the recommendation is to use a surgical mask, the blue and white ones, or these N95s or others that are comparable to that, are much better at eliminating the aerosols and droplets that one may encounter. So important not to just use a cloth mask.
Great. So the next question that we get a lot here, Human Resources gets asked it a lot, facilities as well. If I test positive for COVID-19, but I don't have any symptoms, how long should I isolate for?
So the answer to that is clear, and I should mention now that for all of these sorts of questions and many of the things that I've covered, a great resource, because sometimes these things evolve over time in terms of recommendations, is the CDC website. And
so
if you just
cdc.gov.
cdc.gov, if you put in cdc.gov COVID, you'll come right to the COVID section of the CDC website that'll tell you that. So basically, if you become infected, whether or not you're vaccinated, you need to basically isolate. And that needs to be for 10 days and the resolution of symptoms.
Great. And in addition to that, if I'm vaccinated and I'm exposed to someone who is infected, do I have to quarantine, and for how long?
So another very good question. If you're vaccinated and you're exposed to somebody who has been infected, you do not have to quarantine. But what you do need to do is get tested 3 to 5 days later Certainly if you develop any symptoms, then you should isolate. And the CDC is still recommending that if you do have that sort of exposure event, that it's best to wear a mask if you're inside, just to protect other people in the unlikely event that you might have become infected.
And that raises another question. Not all tests are made the same, right? We've got the rapid tests, we've got PCR tests. If you're exposed to someone who has tested positive for it, what type of test should you do 3 to 5 days after exposure?
The best test, the most sensitive, is still the PCR test. The rapid antigen tests are not quite as sensitive. So I would recommend the PCR test.
That's great. Dr. Bruce Walker, you are a tremendous asset and a wonderful friend to us here at Intersystems. Really appreciate your help and insight. Thank you.
Thanks very much, Tom. It's a pleasure to come back and talk with all of you.
Great. Thank you.
Mm-hmm.